Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. I am so excited today to get to interview Christopher. I ran across his presentation to, I think, the King County Board of Health, right?
Yeah, correct.
Okay.
The King County Board of Health.
Yes, and I just thought it was fascinating. We're in the heart of Seattle, and the more we are here serving the people of Seattle, there are pockets of communities out there that my heart goes out to, and I'm always gleaning King County Board of Health information to say, how do we do better? And when I saw someone like you come on and do such a wonderful presentation, speaking from your heart, I was like, how do I get him on our podcast? So I had Rosario reach out to you, Chris, and you were so receptive. So I just want to thank you publicly for being so accessible and receptive to our invitation. So thank you.
Yeah, I appreciate you having me, Helen. It's a pleasure to be here and be able to speak to this topic to another audience.
Yes.
It is definitely something that I'm very passionate about.
Awesome. Yeah, that very much came across from just reading your materials and what you had to say. But I'm also very sad that people don't get to, one of my staff ran out after meeting him, and Chris just smells so freaking good. So he's going to permeate this podcast room right now, and I'm just going to bask in it. But also his shirt is super cool. So he just looks already cool vibes. Okay.
It's smoke and mirrors, I promise. It's not a cool bone in this body.
I highly doubt that. Tats are pretty cool too. I'm going to have to be like, what's
again,
that
smoke
about?
and mirrors. It's all for show.
But anyways, so Chris, I just wanted to start out by getting to know you a little bit more. I know you have a huge heart for the LGBTQ plus community and access to mental health services for this specific community. And we'll dive more into that in a little bit. But why this topic? Why this community? Can you tell us a little bit more about yourself? Where are you from? Are you a Seattle native? Yeah. Tell us more about Chris.
Yeah, I will give you a little bit of my spiel. My name is Christopher Archiopoli, and my pronouns are he, him, his. I have multi-intersectional identities. I'm a queer gay man in recovery. Okay. So I do identify as a person in long-term recovery from addiction, from substance use disorder. I'm also a person living with HIV. In my experience, I'm not actually from Seattle. I've been in Seattle since 2006, so we're coming close to 20 years.
Might as well be a native.
Yeah, it's pretty close. But it's certainly... There's the OGs that have actually been here their entire lives, so I can't claim that. I was born in Connecticut, grew up in Arizona, and then I moved to Seattle as part of quarter life crisis after college. Okay. So I went to college for marketing, ended up going to hair school when I moved up here and was a hairdresser for a long time. Still do hair a couple days a month, just as like a side hustle. When I entered recovery, I really recognized that I wanted to give back in a different way. I wanted to make an impact in my community in a different way. And so even though you can make a really great impact doing somebody's hair, there's this whole concept of being a day maker, which is like through simple acts of kindness, you can change the trajectory of somebody's life. That's something that I always strove to do as a hairstylist. However, I recognized that I had maybe a bigger impact that I wanted to make. So when I was when I entered recovery, I started looking at what I really wanted to do. And so I got connected with an organization called Pure Washington. I had been receiving services from them for a long time, but when I really got serious about my own recovery in 2016, worked towards becoming a group facilitator as well as a peer coach. In 2022, I made the shift from doing hair full time to working as the site director at Pure Seattle. Pure Seattle is one of 4 adult service sites in Washington state, providing peer-based recovery support services, primarily to the LGBTQIA2S+ community. Anyone is welcome through the door, including allies, making sure that we're providing services to our community and allies. I really dedicated myself to providing services in that area. Ended up leaving there last year, still go there, still work as a volunteer with that organization. But one of the things that I'm very passionate about is really providing support and advocacy for my community.
Okay.
Which is
wonderful.
Where this presentation came from.
Yeah. I hear your heart in saying you want to do more. You want to impact the community. How did your personal experience shape that?
Yeah. I mean, I think I've always been somebody that wants to make a difference. I've been that way for basically my entire life. I like to do things for people. And sometimes I fail, but sometimes I don't do my best. I am only human.
Yes.
I always try to make an effort to give back wherever I can.
Okay.
And this particular topic, talking about behavioral health care services and access to care and identifying like the increased risk of suicide and suicidal ideation for my community is really important to me.
How has mental health or lack of mental health impacted your personal story or your life?
Yeah, I mean, I think that something that's really important to understand about growing up as a queer person, growing up as a gay person, growing up in that identity is that there's a poem that I like. It's a short poem. It's growing up queer is learning to love yourself without example. You know, I grew up in a very loving family. I have nothing but positive things to say about my parents and my siblings and the environment that I grew up in. But I didn't grow up with parents that understood how to raise a queer son. They couldn't provide me examples of how to go through the world. And so as a queer person, we have to wait until we get older to find those role models. You know, we have to wait till we find those queer aunties. I think of like my friends, George and Tony and Mark, who are a little bit older than me, but have been able to provide that example to me of what it is to be a queer person in today's world, what it is to move through the world that way. But to grow up without example, to grow up without understanding how to be yourself or not understanding what's wrong with you. I understood that I was queer in kindergarten, if I look back at it. But it wasn't until 7th grade that I really started to understand what that meant. Wow. And it wasn't until I was in my 20s where I finally started to accept it. And so, you know, that really wears on you when you see on television people hating the person that you are, when you hear politicians saying bad things about who you are, when you see news stories. You know, I grew up at a time when Matthew Shepard was brutally murdered and, you know, nailed to a fence. Watching that happen and fearing that might be you, it's impossible not to have that be an impact on you.
Yeah. Is that why you wanted to highlight this specific topic to King County Board of Health?
When I joined the King County Board of Health earlier this year as a community stakeholder, one of the things that they asked us is if there were any topics that we were interested in bringing. And for me, this was one of the topics that I really wanted to talk about. Yeah. My own personal experience is important, but one of the reasons that it is top of mind for me really is the fact that the political environment right now is very divisive.
Yes.
And I identify as a cisgendered gay man. I was assigned male at birth, and I still identify as being a male, but my trans and gender nonconforming friends are struggling right now. When you turn on the news and are being told constantly that you don't exist or that you don't have a right to exist or that you're a groomer or a pervert or all the terrible words that are used to describe what should be human. That is the word that should be used to describe somebody. But people are being demonized and told that they don't have a right to exist. And to me, that's what brought this forward again. I identified, obviously, having grown up that way, growing up the way that I did. I really wanted to shine a light on what people are going through and the challenges that youth face, even though the world is slightly more accepting than it was when I was a kid. I grew up in the 90s. So 30 years later.
Hey, I'm right there with you.
Is it 30 years? I think it's 30 years later. Things have progressed. A lot of the shift has been towards my community, which there is a lot of privilege being a cisgendered white man. Like I can walk into a room and I don't necessarily have to identify as gay. I don't have to identify as queer. I don't have to identify as living with HIV or being in recovery. I can get away with being stealth about my identities. Not everyone has that luxury. So really wanted to shine a light on the challenges that big parts of our community are facing right now.
What big mental health challenges is the community that you're serving specifically wanting to highlight to the rest of us?
Yeah, I think that mental health touches every part of your life. I think there's this great movement right now acknowledging that mental health is health and it's okay to use a sick day for mental health. You don't have to be coughing up a lung or have COVID to use a sick day.
Yes, it's called self-care days.
Right. If you're not feeling up for it, if you have a customer service job and you're not capable
of being your best
of serving a customer, then you shouldn't go to work. If you need a day in bed to rest and rejuvenate, you should be able to do that. And for this community, for the queer community, for the LGBTQIA2S+ community, depression, anxiety, substance use disorder, suicide and suicidal ideation, all of these things are really things that are impacting the community on a regular basis.
Are you trying to highlight that there is a lack of mental health awareness surrounding those topics and there's not enough professionals to address those topics?
Yeah, it's sort of twofold. It's definitely a lack of access to services and resources.
Okay.
Finding something that is culturally affirming, finding providers that understand the issues. If a trans person walks through the door, is their physician going to understand the challenges that they're facing and the healthcare issues that they have, whether that be mental health or just physical health?
Okay.
As a queer person, am I going to walk into and see a physician and be understood? Those access to resources, yes, that's huge.
Yes.
The other side of it that I wanted to really raise is that we don't live within a bubble. Like that when things are on the news, it impacts people badly. If society is constantly telling people that they shouldn't exist, that is impacting them badly.
Yeah.
And when they hear this over and over and over again,
it
doesn't change who they are because that's who they are. It's not going to make me less of a gay person. It's not going to make a trans person less of a trans person. It is only going to make us feel terrible about ourselves. And what that does is that it increases the likelihood of developing a substance use disorder. It increases the likelihood of anxiety and depression. It increases the likelihood of somebody experiencing suicidal ideation or completing suicide. I think that people say things, and I don't want to speak to their intention, but I think that it's important that people understand the impact of you don't say things in a vacuum. And when you're saying things about an entire group of people, it impacts people. And it's not just people that are well-placed to access services. It's youth who may feel lost and not fully understand who they are yet. It is people who may be lower income or may already have behavioral health concerns. Like we don't want to make people's lives harder. We shouldn't be making people's lives harder.
Well, I just heard your heart in that. Thank you. So before we started this podcast, I was telling Chris that, hey, I put my foot in my mouth all the time. If there's anything that I say or questions that I ask that is not appropriate or triggering or that I'm not saying the right things because it would offend you. And you were very kind to say it's very hard to offend you. But what if I accidentally say something that I wasn't supposed to say or mislabel you or anything like that? What would you like to hear in response once you say, hey, that wasn't okay? And can I correct you? And can I just help you with that language a little bit? What response would you like from me?
Yeah, one of the things that I've learned, and I want to acknowledge that I'm not perfect. I make mistakes. A lot has changed. I'm a 42-year-old man. When growing up, the world that we are in right now is not the same world that we were in when I grew up. And so I have had to learn and shift my language and learn how to address people appropriately. So it's not something that just happens naturally, but really what is important is that you are open to learning and open to listening.
Sure.
And what I've learned is that when I make a mistake, if someone corrects me, I don't apologize. I say thank you. Because by apologizing, you are then forcing someone to forgive you. So you're flipping it back on them and forcing them to take an action for your own mistake. And so they've already had to go and correct you.
Okay.
The next step
which is difficult sometimes, right?
Right, because people are exhausted by education.
Yeah.
If somebody who is transgender or gender nonconforming are exhausted by having to educate people all the time about pronouns and identity.
Yeah, I'm sure. Yeah.
It's all day, every day.
Yeah.
And I've experienced that myself, even just with queer issues and being a gay person and living with HIV and being in recovery from substance use. Education is exhausting when you're doing it all day.
Yeah. Don't you wish you just wear a shirt?
Yeah. Here's the list of appropriate terms.
Yes.
here's your glossary.
Yeah.
It's front and back.
Yes.
But yeah, I think what I've learned is just say thank you.
Okay.
And it really moves the conversation along.
Okay.
Because the more you draw attention to your mistake, the more it draws attention to your mistake.
Okay.
And it forces the person that you've misgendered or misidentified, to have to live in this awkward moment.
Yeah.
The faster you can say thank you so much and then just literally move on to move away from the
conversation. And that doesn't feel dismissive.
Someone will tell you if it does, but what I've learned, this is just my own personal learning and experience, is that you don't want to spend too much time on the mistake, because then that becomes the center of the conversation. And people are just people. They just want to have a real, normal conversation with you.
Yeah,
if you were talking about coffee or the weather, move back to talking about coffee or the weather.
Very good. Very good. Thank you for that. That's actually really insightful. Because I hope you hear my heart in the sense of we here at 3W serve everyone and anyone that walks through our door. And we want to get better and better at meeting people where they're at, providing compassionate care. Whoever comes through our door, we want to extend the best type of hospitality and respect, and just continuously refining and learning how to do that is really important to us here. Thank you for that.
Yeah. And what I will tell people is that no one knows themselves better than that person knows themselves. I am not of the trans or gender nonconforming communities.
Yeah.
So I don't speak for those communities. I'm speaking from my personal experience. And even the word queer, I like to use the word queer, but for many, queer is still a pejorative. There's a historic context behind the word queer that isn't comfortable for a lot of people. It wasn't comfortable for me for a long time because I grew up with queer being a slur. As acronym has gotten longer and longer, I've moved to the word queer because I feel like it's more inclusive.
Okay.
But I always encourage people to be curious and say, and ask, how do you identify? And what's kind is to identify yourself as well. Even though I may think that it's obvious that I'm cisgender and that my pronouns are he, him, his, it's still really respectful when I'm introducing myself to somebody, if I'm hoping to get information from them, that I start by volunteering my own information. Hey, I'm Christopher. My pronouns are he, him, his, and I identify as a queer gay man. And that just opens up the conversation. If you're wanting to make somebody feel comfortable, putting all that out there right away lets them know, oh, this is a person that I can be myself with. You're immediately going to remove some of the discomfort and some of the barriers that might exist.
Wow. Okay. I'm learning so much from just, 20 minutes with you, Chris. Not only do you smell good, but I'm learning so much. Oh my gosh.
Well, and it's really the outside that counts.
Getting back to the acronym, can you break down for our listeners and for me what each letter stands for?
Yeah, absolutely.
Okay.
So I think most people really, they know the LGBT or the LGBTQ.
Yes.
And that's the one that tends to get used the most often. There's actually a longer version of this, and I'll just go through the whole long version if that is helpful.
Yes.
So L is for lesbian, G is for gay, B is for bisexual, T is for transgender, Q is for queer. There's also a second Q, which is questioning. I is for intersex. Okay. Then there's a P, which is pansexual. And then there is the 2S, which stands for two-spirit. And then there's AA, which is asexual and ally. It's a longer acronym, which is why I've really moved to queer. Yeah. I like the longer acronym because it gives everyone sort of representation. It really does cover most of the bases.
What is two-spirits?
Yeah, so two-spirit is generally associated with Indigenous folks, Indigenous people.
Okay.
So within Indigenous tribes and groups around the world, actually, and historically, this idea of being two-spirit exists and encapsulates transgender, but also being gay. There is just like this openness around gender and sexuality. I'm not giving it the full range of what it means. Yeah. There's some great videos on YouTube. I actually teach a class about this sometimes, and so I usually show a video when I'm talking about two-spirit because it's better when someone is telling that story for themselves. Yes. Sort of like the short version is the identity among Indigenous peoples that's generally associated with like sort of a fluidity of gender and sexuality.
So how was your presentation to the King County Board of Health received?
I think it was received really well.
Yeah, that's what I thought, but I wasn't there, so you got to tell me.
Yeah, I was a little surprised. The King County Board of Health represents all of King County, and there's diverse stakeholders in the group. Yes. I'm new to the King County Board of Health this year. It was my first time presenting to them, so I was definitely a little nervous. Presenting something that I'm really deeply passionate about, and which I wasn't sure exactly how it would be received, but I was overwhelmed by the support that my fellow board members showed to the topic, the really amazing questions that they asked to follow up. Several of the board members sit on both the Seattle City Council as well as the King County Council, and there were requests to follow up with my co-presenters. As part of my presentation, I gave the opening and closing, but I had also invited the executive directors from Seattle's LGBTQ+ Center, as well as the CEO of Pure Washington. Seattle's LGBTQ Center and Pure Washington have both been around for about 40 years, providing services to the community. Really, both of them started in the mid-'80s, providing care for people living with HIV and AIDS. And as things have shifted for people living with HIV and AIDS, their missions have shifted and have broadened to include more people. Nikita Venus from the LGBTQ Center gave a great presentation, and then Joshua Wallace actually wasn't able to be there, but he had sent some slides beforehand, and because I had worked for that organization, I was able to share some of the relevant information about peer support and its impact on our community.
Yeah. And what was your request to the King County Board of Health? Was it just to raise awareness about the lack of mental health access, or was it asking them to do something?
Primarily, I went in with this idea that I just wanted to raise awareness. Because I do feel like people maybe don't understand the full scope of how people are being impacted. One of the things that I learned working at Pure Seattle is that Seattle and King County have a number of trans refugees that have come from other parts of the country due to more conservative policies, more conservative environments. So we have people that are coming from different parts of the country to live in their cars here because they'd rather be here in their car than in housed in Kentucky. So it was raising awareness around those things, raising awareness around how conservative policy can really be negatively impactful to people's physical and mental health. At the end of the day, what makes a difference is money. If we're not funding programs, if we're not funding ideas about how to address these challenges, then nothing's going to change. I can change minds. Hopefully I've taught you something, and
plenty of
hopefully
things.
I've taught some of your listeners something, but that only does so much. We really need to invest in better resources, more access to resources, more culturally affirming care. And that's really what I was hoping, in addition to increasing awareness, that some of the key stakeholders that sit on the Board of Health, who hold purse strings in their roles, would be able to at least have this on their mind as they make funding decisions.
Yeah, policies and all that whatnot. On your presentation, there were some stats on here. Would you mind reading two that kind of stands out to you?
Yeah, I would be happy to. One of the slides really was about how mental health for young people is impacted. Suicide is the second leading cause of death among young people aged 10 to 14, and the third leading cause of death among 15 to 24-year-olds. Lesbian, gay, bisexual, transgender, queer, and questioning young people are at significantly increased risk. And then
those are, I've been reading them. It's hard to read. It's hard to.
Well, and all of this stuff is easily accessible on the internet. The Trevor Project is an amazing national organization that focuses on providing services and support for LGBTQIA2S+ youth and trying to reduce suicide and suicidal ideation. I mean, the other statistic that was really impactful to me is so in the University of Washington's trans health study recently, they identified that 32% of their study participants needed treatment for mental health but did not receive it. Mental health care is essential, but people aren't accessing it for whatever reasons. And I would identify that in a lot of ways that's the shame and stigma that people experience when they go to see providers. I know even with my own privileged identity, I've left providers in tears because of the way that I've been treated for being gay, for being in recovery, for being living with HIV. I've been in the emergency room and had to describe, as soon as somebody hears that I have HIV, they're like, oh, that must be the reason you're here. I have a pneumonia. We don't need to talk about my HIV right now. I take my pills every day. I saw a provider last year for tonsillitis, and he treated me so differently once he found out that I was in recovery that I left his office in tears. And I did that as a 41-year-old person that is in a great place. And what really made me think, when I think about the experiences I've had with healthcare providers who are generally well-meaning, I'm not down-talking them. Many of my friends are physicians and medical providers. But what made me think is, if I am having this experience, what experience is somebody who is less privileged than me having? And are they coming back? I am strong enough to wipe my tears and turn around and pick up the phone or send an email and advocate for myself and find a different provider and find different access to service. But is somebody else going to do that? And the answer, I think, is often no.
Wow. I'm sorry you had to have that experience.
I'm sorry that anyone has to have that experience, because physicians are supposed to be healers. Healthcare providers are supposed to be healers. You're supposed to go to feel better. And
it's supposed to be healthy.
not worse.
Not worse. Not tears.
Oh,
gosh. Okay. I can talk from my own experience in the sense of there are times where I go to the doctors and I get swept up in that whole, they're in a power dynamic type of situation, right? They're in the white lab coats. They have all these credentials behind their names. They know, they probably know what they're talking about.
Right.
But they're making me feel like crap. Hey, wait a minute. That's not how I'm supposed to be feeling. I'm supposed to be feeling empowered and be able to advocate for myself, to be able to ask questions and concerns and all of that stuff. This doesn't feel right. And it's happened to me. So I totally get what you're trying to say. What are some resources out there in Seattle that people can look into or tap into if they are looking for mental health services?
If you're looking for professional services, looking at Psychology Today, looking online, looking at reviews, talking to friends, if you're looking for a professional mental health provider, that's really what you need to do, is find out who is going to be affirming to you. Unfortunately, we don't have a specific organization that exists right now. We did have a mental health care provider, Seattle Counseling Services. Unfortunately, they lost funding a couple years ago, and no one has come in to fill the void. The resources are a little bit more spread out. There are quite a few organizations, though, that provide services to the LGBTQIA2S+ communities. The Seattle's LGBTQ+ Center, POCAN, Utopia, which is in South King County, the Lavender Rights Project, Lambert House, which provides youth services, Entre Hermanos, Lifelong, the Ingersoll Gender Center. And then I'm always partial to Pure Seattle and Pure Kent, which are part of Pure Washington. That organization saved my life. And I'm always going to give them a shout out and make sure that people understand the value of peer support. And peer support exists within the continuum of care. It's this sort of like new concept that is not that new anymore, but people don't have a full understanding of yet. And peer support is people with lived experience supporting people that are living through an experience.
Yeah.
And there's a really special magic when somebody sits down with you and starts explaining their story to you, and you say, I know. Behavioral health care providers are book smart. They probably know more than me about a lot of things, but if they've never had the experience of using drugs, if they've never had the experience of, living through substance use disorder or living with HIV, they can only provide a certain level of support. And so peer support, there are several certifications in Washington State and nationally. I'm a certified peer counselor through the Washington State Healthcare Authority. I'm also a certified peer coach through the Connecticut Community of Addiction and Recovery, which is a national certification. So we're working on creating licenses for peers because we have not enough behavioral health care providers right now. And,
across the board,
and the barrier to entry is so high.
Yes.
It takes years to get that education. So
yes,
for every 10 people that we lose, we might only replace them with one.
Yeah.
And it takes years to replace somebody who leaves the industry.
Wow.
Peer support, the barrier is a lot lower. It still requires education and certification, but peers more and more are coming in to fill that gap. And so in King County, Pure Seattle and Pure Kent both provide services to people with behavioral health and substance use disorder, as well as other chronic health conditions.
Maybe this is an obvious question, but has COVID caused any barriers?
I did, for sure. I mean, I think that obviously so many people are getting COVID still every day.
Yes.
So we're not through it.
Yeah, but like the more lockdown years.
Absolutely.
Yeah.
I think that what we saw across all demographics was an increase in mental health challenges. What we did see, though, with people in recovery is a high relapse rate. We saw people with behavioral health challenges that were isolated have high relapses. They maybe were healthy prior, but experienced additional challenges. And having all of these resources shut down for at least a year, most of these places weren't open at all. A lot of things shifted to virtual like the rest of the world. When you're doing support, when you're doing connection, there is no replacement for being as close as you and I are right now.
Yes.
We could have done this via Zoom, but this is way better, isn't it?
I wouldn't have been able to smell you.
Exactly.
And experience Chris.
You're making your viewers jealous.
I mean, you're right. In all seriousness, there's nothing to replace that one-on-one. And I'm so grateful that you're here. I'm so grateful that we're talking about this topic. And what's one message that you would like to leave our listeners today? I know, because we just scratched the surface, right? We just scratched the surface. And I'd love to have you back again for other deep dives, but we have to start somewhere.
Right.
And so what do you want to leave our listeners with today? What's one message?
Well, I think I want to leave people with the broad message that everyone is human. And I think that we all need to treat each other a little bit better. The person living unhoused on the street with substance use disorder is a person.
Yes.
Our trans and gender nonconforming neighbors are people. I am a person. You are a person. And I think we've all heard of the golden rule, which is, do unto others as you would have them do unto you. I like to think of the platinum rule, which is treat others the way they want to be treated. I think we can all do a little bit better.
I agree. I think there's I was sitting in a coffee shop right next to this person, and I had to go to the bathroom. So I was like, can you watch my laptop really quick? And this person and I did that for each other. And we both looked at each other. We're like, are you having a good day? Like, why aren't people having these types of conversations? Just strangers having just a kind conversation. I know that's might be very surface level, but it really made my day. Just being able to connect with someone that I've never met before, trust them with something that I care very much about. But we both started talking about like, why aren't people more kind to each other these days? I don't know. There's this lost art, I think. And especially out here.
Yeah.
I think there's this isolation, and I don't know what it is, but...
Yeah, we could have a whole other podcast about kindness. But I think that is my big takeaway is, like people who are treated well do better.
Yeah.
And if you really want to make an impact on people's mental health, treat them better.
Thank you. Thank you for leaving us with that, Chris. I am grateful for your time and that you brought this up to King County Board of Health. Your presentation really stood out to me, and I'm grateful for the opportunity to sit down with you and learn more myself. And I don't know, maybe 3W can end up on your resource list one of these days.
I would love that. I would love if we were able to include you. Walking through your building, I was just so impressed by what you all are doing. And, I'm always trying to learn about new resources.
Oh,
I'm grateful to the King County Board of Health, and I'm grateful to you. Thank you so much for having me today.
Yes. All right, listeners, thank you so much for joining us. Thank you, Chris, for your time. If you have any questions, please reach out to us. I'm sure we'll list some of the stuff we kind of went over on the description of the podcast. Great conversation. Thank you. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.